This is manual muscle testing done by the students of the Mohave Community College Physical Therapist Assistant Program. Lauren Winsborough, Krista Smith, Shell Holmes, Roger Rosado, Jamie Blanchard, and Ben Smith. Manual muscle testing grading. 0 out of 5, the absence of muscle contraction. 1 out of 5, ability to produce a muscle contraction that is detectable by palpation or observation, but is not strong enough to cause joint movement. 2 out of 5, the ability to produce a muscle contraction that causes complete joint motion without the resistance of gravity. 3 out of 5, the ability to produce a muscle contraction that causes complete joint motion against the resistance of gravity. 4 out of 5, the ability to produce a muscle contraction that causes complete joint motion against gravity and withstands moderate manual resistance to an isometric contraction but yields against maximal manual resistance. 5 out of 5, the ability to produce muscle contraction that causes complete joint motion against gravity and withstands maximal resistance to an isometric contraction. First, we will start with the wrist and hand, with Lauren as the clinician and Krista as the patient.
Hi Krista, my name is Lauren. I'm a PTA student. Today we're going to be looking at your wrist and your hand. Is this comfortable for you? Yeah, it's fine. We want to make sure that our patient is comfortable and everything. All of our extremities are supported during manual muscle testing. Also, what we want to do first, before we even do any manual muscle testing, is assess our patient's ability to move. Okay Krista, so do you think you could do this for me? Show me how you do that. Can you do this? Can you spread your fingers out and in? Can we do our thumb like this? Like that, out like this, like an L. Great. So now we'll start examining the patient's posterior surface for the extensor muscles.
The extensor carpi radialis brevis originates the common extensor tendon from the lateral epicondyle of the humerus. Inserts at the base of the third metacarpal, and it is a wrist extender.
Okay, so when we're testing the extensor carpi radialis brevis, we want our patient to be in slight extension, but not too much extension. What we're going to do is we're going to put pressure below the third metacarpal, and we're going to tell our patient to hold and not let me move you. This doesn't mean put all your pressure back, but just resist my motion on the third metacarpal. Hold, don't let me move you. Nice job.
The extensor carpi radialis longus originates at the distal 1/3 of the lateral supracondylar ridge of the humerus. It inserts at the base of the second metacarpal and acts as a wrist extender.
So in this instance, we'll also have our patient slightly extend our wrist, but we will be pressing on the radial side with maybe about 3 fingers with some more pressure than we did with the brevis. And we're going to tell the patient, hold, don't let me move you. Hold, don't let me move you. Good job.
The extensor digitorum. It originates at the common extensor tendon from the lateral epicondyle of the humerus. It inserts at the base of the middle and distal phalanges of the 2nd through 5th fingers. It extends the 2nd through 5th fingers.
Great. For this one, I remembered as the communist, meaning that we come in through here and we see all of these. So how we would test this is we would extend, we would slightly extend, and we're going to put our pressure with maybe 1 finger, and we're going to have our patient hold, don't let me move you, hold, don't let me move you. Good job.
The extensor indicus. It originates the posterior surface of the distal shaft of the ulna and interosseous membrane. It inserts the tendon of the extensor digitorum at the level of the 2nd metacarpal. It extends the 2nd finger.
So for the extensor indicis, I want to isolate my index finger, thus indicis. And what we want to do is have our patient in slight extension, not too much extension. You don't want her to work other muscles. And we're going to apply our pressure at the distal phalanx, and we're going to say, hold, don't let me move you. Hold, don't let me move you.
Flexor carpi ulnaris. It originates on the humeral head with the common flexor tendon from the medial epicondyle of the humerus, and the ulnar head on the posterior surface of the proximal 2/3 of the ulna. It inserts the pisiform, the hook of the hamate, and the base of the 5th metacarpal. It is a wrist flexor.
For the flexor carpi ulnaris, what we're gonna do is we're gonna get a hold of Krista's hand and we're gonna be on the ulnar side. We're gonna be putting our pressure right in about here. And we're going to try to put Krista in extension, and we're gonna tell her to hold and don't let me move you. Hold, don't let me move you. Hold, don't let me move you.
The flexor carpi radialis, it originates on the common flexor tendon of the medial epicondyle of the humerus. It inserts the base of the second and third metacarpals, and it flexes the wrist.
So for the flexi carpi radialis, we're going to do something in the same manner, except for we're going to be on the radial side, and we're going to be putting our pressure on the thenar eminence. And what we're going to do is we're going to tell Krista, while we try to push into extension, hold, don't let me move you. Hold, don't let me move you. Nice job.
The flexor digitorum superficialis. It originates the common flexor tendon from the medial epicondyle of the humerus, the ulnar collateral ligament, the coronoid process of the ulna, the interosseous membrane, and the proximal shaft of the radius. It inserts the sides of the middle phalanges of the second through fifth fingers. Flexes the second through fifth fingers.
So for this particular one, we're going to put Krista's wrist into a neutral position. We're going to make sure we're resting it on here, and she's going to kind of make a pointing, like she's pointing her finger. So for the superficialis, we're going to make sure we are going to stabilize the metacarpal, and we're going to put our pressure right on the proximal DIP joint, and we're going to say, go ahead and hold, don't let me move you, hold, don't let me move you.
The flexor digitorum profundus. It originates the anterior and medial surfaces of the proximal 3/4 of the ulna. It inserts the bases of the digital phalanges, palmar surface of the second through fifth fingers. It flexes the second through fifth fingers.
Okay, so for this one, we're also going to keep Krista in the same manner. She's going to have a neutral wrist, and we're going to block the metacarpal and the proximal phalange, and we're going to apply pressure at the distal phalange, and we're going to tell Krista, hold, don't let me move you, hold, don't let me move you. Good job.
The palmaris longus. It originates the common flexor tendon from the medial epicondyle of the humerus. It inserts the flexor retinaculum and palmar aponeurosis. Flexes the wrist.
So for this particular one, we want to have our finger placement right in the palmar aspect of her hand, and we're going to slightly flex, and we're going to tell Krista to resist our movement to extend, meaning her ability to flex. Go ahead and hold, don't let me move you, hold, don't let me move you. Good job.
The palmar interossei. It originates at the base of the first, second, fourth, and fifth metacarpals. Inserts at the base of the proximal phalanx of the related finger and the extensor aponeurosis. It adducts the thumb, second, fourth, and fifth fingers toward the third finger.
Okay, for this particular one, we remember it as pads, and that's because it works to abduct. So what we would want to do is we want to make a 5. Okay, so I'm going to put my fingers in between your fingers, and I want you to keep your fingers straight, and I'm going to try to move, and I want you to resist without flexing your fingers. Don't let me move you. Don't let me move you. Good job.
The dorsal interossei. It originates at the adjacent sides of all metacarpals. It inserts at the base of the proximal phalanx of the second, third, and fourth fingers and the extensor aponeurosis. It abducts the second, third, and fourth fingers at the metacarpal phalangeal joints.
Okay, so for this particular one, what I want you to do is I don't want you to be all spread out. I want you to be slightly spread out, and I'm going to put pressure here, and I just want you to resist that pressure. I don't want you really to stretch your fingers. I just want you to resist my pressure. So hold, don't let me move you. Hold, don't let me move you. Good job.
Lumbricals of the hand. They originate the surfaces of the flexor digitorum profundus tendons. Insert the extensor aponeurosis on the dorsal surface of the phalanges. They extend the second through fifth fingers at the interphalangeal joints.
So how we would test some of these lumbricals, we could do them individually. We would have them, Krista, can I have you hold the card like this? in your fingers? Okay, great. So just hold on to that and don't let me grab it from you. Nice, good job. Let's do it with the second finger. Awesome. Don't let me move you. Good job. Third. Don't let me move you. Nice. Can we do the pinky? Don't let me move you. Good job.
Opponent's pollicis. They originate the flexor retinaculum and tubercle of the trapezium. They insert in the entire length of the first metacarpal bone, the radial surface. And they are in opposition of the thumb at the carpal-metacarpal joint, bringing the pads of the thumb and the fifth finger together.
Okay, Krista, for this one, I would like you to go like this. So can we try doing that? Great. That's the motion that I want you to do. So I want you to keep it there for me and resist my movement. Okay? I'm going to go on this side. Hold, don't let me move you. Hold, don't let me move you. Good job.
Opponent's digiti minimi. They originate at the hook of the hamate and the flexor retinaculum. They insert the shaft of the fifth metacarpal and the ulnar surface. And they have an opposition of the fifth finger at the carpal-metacarpal joint.
For this one, we're also going to have her show us how we oppose, the same way that we did with the pollicis. I'm going to support you here. Great, Krista. So what I want you to do when I put pressure here, I just want you to hold and don't let me move you. Not a lot of pressure, just some pressure. Not everybody's able to oppose, so you may have to actually show them with your own hands how to oppose. So for this one, we're going to hold, don't let me move you. Nice job.
The adductor pollicis. They originate, decapitate the second and third metacarpals. Insert the base of the proximal phalanx of the thumb. They adduct the thumb.
Okay, great. For this one, what we're going to do is we're going to have Krista in a slight adduction, and I'm going to apply pressure right here, and I'm going to tell you, Krista, hold and don't let me move you. Now, I'm going to have to instruct the patient what adduction is, so we're going to make an L. That's kind of, so we don't want to go all the way out, that we can, just right in the middle. So just make an L, neutral L, right here, okay? So then hold, don't let me move you, hold, don't let me move you. Nice job.
Abductor pollicis brevis. It originates at the flexor retinaculum, the trapezium, and the scaphoid tubercles. It inserts in the base of the proximal phalanx of the thumb. They abduct the thumb.
Great. So this part we're going to be on the brevis, and the brevis will be the short one, so we'll start right here. All right, Krista, I want you to keep your thumb right here. I want you to hold and resist my motion. It won't be a lot of resistance, but we will put some resistance on that thumb. So I want you to keep it here. We're going to start here. I'm going to hold, don't let me move you. Hold, don't let me move you. Nice job.
Abductor pollicis longus. They originate at the posterior surface of the radius and ulna and the interosseous membrane. Insert into the base of the first metacarpal. They abduct the thumb, extend the thumb, and abduct the wrist.
All right, great. We're going to do the same thing. We're going to keep Krista in a kind of a neutral position here, and we're just going to be right out here, just a little bit, slightly, not too much. And I'm going to apply my pressure right here, and I just want you to resist my motion, okay? So hold, don't let me move you. Hold, don't let me move you. Hold, don't let me move you. Nice job.
Flexor pollicis longus. They originate at the anterior surface of radius and interosseous membrane. They insert to the base of the distal phalanx of the thumb. They flex the thumb.
For the extensor pollicis brevis, what we're going to do is going to put her in slight extension here on her thumb, not full extension, just kind of mid-range. And I'm going to put pressure right here, and I'm going to tell her to hold, don't let me move you. Hold, don't let me move you. Nice job.
Extensor pollicis longus. They originate at the posterior surface of the ulna and interosseous membrane. They insert in the base of the distal phalanx of the thumb, and they are thumb extensors.
So for the extensor pollicis longus, we're going to kind of isolate this joint, both of these joints, because we want to see the extension in the distal of the thumb. So I'm going to have her hold, don't let me move you, hold, don't let me move you. Nice job.
This is the elbow joint, and we're going to start out with the biceps brachii short head. The origin is the coracoid process of the scapula. It inserts on the tuberosity of the radius, and the action is to flex the elbow.
Okay, first of all, we're going to get the elbow up on some towels to get this neutral right here. I'm going to put her in a little bit of flexion, and then we're going to start right here. I'm going to say hold, and don't let me move you. Hold, don't let me move you. Good.
Brachioradialis. The origin is the proximal 2/3 of the lateral supracondylar ridge of the humerus. The insertion is the styloid process of the radius, and the action is to flex the elbow.
Okay, for the brachioradialis, we're going to turn the thumb facing up, and we're going to go right here. Hold, don't let me move you. Hold, don't let me move you. Good.
Brachialis. The origin is the lower half of the anterior surface of the humerus. Insertion is the tuberosity and coronoid process of the ulna. The action is flexes forearm at the elbow.
Okay, for this one, we're going to turn you with your palm facing down, and we're going to go right here. And now hold, don't let me move you. Hold, don't let me move you. Good.
Triceps brachii. Origin, infraglenoid tubercle of the scapula. Insertion, olecranon process of the ulna. And the action is to extend the elbow.
For this, we're going to turn the palm facing up, and I'm going to be right here. Hold, don't let me move you. Hold, don't let me move you.
The supinator. The origin is the lateral epicondyle of the humerus, radial collateral ligament, annular ligament, and supinator crest of the ulna. The insertion is the anterior lateral surface of proximal 1/3 of radial shaft, and the action is to supinate the forearm.
For this, we're going to have the thumb up in a neutral position, and we're going to be right here, and we are going to say hold, and don't let me move you. Hold, don't let me move you.
The pronator teres. The origin is the common flexor tendon from medial epicondyle of humerus and coronoid process of the ulna. The insertion is the middle of lateral surface of the radius. The action is to pronate the forearm.
For this, we'll resist pronation, and I'm going to be here and say hold, don't let me move you. Hold, don't let me move you.
The pronator quadratus. The origin is the distal 1/4 of the anterior surface of the ulna. Insertion is the distal 1/4 of the anterior surface of the radius, and the action is to pronate the forearm.
For this one, we're going to put you back into flexion, and we are going to start here and say hold, don't let me move you. Hold, don't let me move you.
Coracobrachialis. The origin is the coracoid process of the scapula. The insertion is the medial surface of mid-humeral shaft. The action is flex of the shoulder and adducts of the shoulder.
Alright, so for coracobrachialis, we're going to place the elbow into some flexion to deactivate the biceps. We're going to push onto it right here, pushing back into shoulder extension and into some abduction. You're going to direct your patient to hold, don't let me move you. Hold, don't let me move you. Good job.
Supraspinatus. The origin is the supraspinatus fossa of the scapula. The insertion is the greater tubercle of the humerus. The action is it abducts the shoulder and stabilizes the head of the humerus in the glenoid cavity.
Okay, so for supraspinatus, we're going to come over to this arm here. We'll place the patient into about 90 degrees of elbow flexion. We're going to place pressure on the elbow joint, on the lateral portion of it, And we're going to direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Infraspinatus. The origin is the infraspinous fossa of the scapula. The insertion is the greater tubercle of the humerus. The action is it laterally rotates the shoulder, adducts the shoulder, and stabilizes the head of the humerus in the glenoid cavity.
Okay, so for infraspinatus, we're going to place the patient into about 90 degrees of elbow flexion. We're going to place pressure on the lateral portion of the wrist, direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Teres minor. The origin is the upper 2/3 of lateral border of the scapula. The insertion is the greater tubercle of the humerus. The action is it laterally rotates the shoulder, adducts the shoulder, and stabilizes the head of the humerus in the glenoid cavity.
Okay, so for teres minor, it's very similar to infraspinatus. You're going to place the patient in about 90 degrees of elbow flexion, a little bit of abduction, and you're going to place the pressure on the mid-forearm. And direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Subscapularis. The origin is the subscapular fossa of the scapula. The insertion is the lesser tubercle of the humerus. The action is it medially rotates the shoulder, and it stabilizes the head of the humerus in the glenoid cavity.
So for subscapularis, again, you're going to place the patient about 90 degrees of elbow flexion. You're going to place pressure on the medial portion of the wrist. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Deltoid. The origin is the lateral 1/3 of the clavicle at the acromion and spine of the scapula. The insertion is deltoid tuberosity. The deltoid abducts the shoulder. The anterior fibers flex the shoulder. Medially rotate the shoulder. Horizontally abduct the shoulder. The posterior fibers extend the shoulder. Laterally rotate the shoulder. Horizontally abduct the shoulder.
Okay, so for the deltoid, the anterior deltoid runs up here in the anterior portion of the arm. You're going to bring the arm into a little bit of flexion, a little bit of abduction. You're going to place pressure posteriorly on the arm. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job. For the middle deltoid, we'll come over here to this one. You're going to place the patient about 90 degrees of elbow flexion. You're going to place your pressure just above the elbow. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job. Now for the posterior, you're going to bring the elbow back into a little bit more extension. You're going to place pressure coming anteriorly. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Levitator scapula. The origin is the transverse processes of the 1st through 4th cervical vertebrae. The insertion is the medial border of the scapula between superior angle and superior portion of spine of scapula. The action, it elevates the scapula, downwardly rotates the scapula, laterally flexes the head and neck, rotates the head and neck to the same side.
Okay, so for levator scapula, you're going to try to come back here to the scapula and get a hold of the superior angle of that scapula. And you're going to have the patient shrug your shoulders up just a little bit, okay? And you're going to try to push down on that superior angle, direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Upper trapezius. The origin is the external occipital protuberance and the spinous processes of C7 through T12. The insertion is the lateral 1/3 of clavicle, acromion, and spine of the scapula. And the action is it extends the head and neck.
Okay, so for upper trapezius, we're going to place the patient into a little bit of, I guess you would call it shoulder elevation. So shrug your shoulders a little bit. You're going to place pressure right here on the acromion, pushing downward. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Teres major. Origin, inferior angle and lower 1/3 of lateral border of the scapula. Insertion, crest of the lesser tubercle of the humerus. And the action is it extends the shoulder, adducts the shoulder, and medially rotates the shoulder.
Okay, so for teres major, you're actually going to take the arm and you're going to have the patient bring her arm back and place it near the iliac crest. You're going to place pressure toward the anterior portion of your patient from the area of the elbow. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Latissimus dorsi. The origin is the inferior angle of the scapula. The spinous processes of the last 6 thoracic vertebrae, last 3 or 4 ribs. The insertion is the inner tubercle groove of the humerus, and it extends the shoulder, adducts the shoulder, and medially rotates the shoulder.
Okay, so for latissimus dorsi, we're going to bring the arm into extension, the elbow into extension, and you're going to place pressure onto this aspect of the wrist here, pushing anteriorly. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Rhomboid major. The origin is the spinous processes of T2 through T5. The insertion is the medial border of the scapula between the spine of the scapula and the inferior angle. The action is it adducts the scapula, elevates the scapula, and downwardly rotates the scapula.
Okay, so for the rhomboids, we're going to bring the patient's arm out this way. And we're going to actually place the thumb pointing downward. And we're going to put pressure going anteriorly. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Rhomboid minor. The origin is the spinous processes of C7 through T1. The insertion is the upper portion of medial border of the scapula at the level of the scapula, spine of the scapula. The action is it adducts the scapula, elevates the scapula, and downwardly rotates the scapula.
And the test for the rhomboid minor is actually the same as the rhomboid major. You will pull the arm out. You will place the thumb pointing down toward the floor. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Trapezius. The origin is the external occipital protuberance and spinal processes of C7 through T12. The insertion is the lateral 1/3 of clavicle, acromion, and spine of the scapula. And the action is the middle adducts the scapula and stabilizes the scapula.
Okay, so for the middle trapezius, it's very similar to what you would do with the rhomboids, except you place the thumb pointing up. Place the pressure onto the wrist anteriorly. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
The lower trapezius depresses the scapula and upwardly rotates the scapula.
Again, with the trapezius, you're going to bring the thumb pointing down, and with the lower, you're just going to bring the shoulder into a little bit more adduction than you were with the middle trap. You're going to place your pressure onto the wrist anteriorly. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Serratus anterior. The origin is the external surface of upper 8 or 9 ribs. Your insertion is the interior surface of the medial border of the scapula, and the action is it abducts the scapula, upwardly rotates the scapula, depresses the scapula, and holds the medial border of the scapula against the rib cage.
Okay, so for the serratus anterior, we're actually going to have our patient roll back over so that she's supine. If you could please, Jamie, roll back over so that you're in a supine position. I'll move this pillow back here so it's behind your head. Comfortable there?
Yes.
Good. Now, serratus anterior, you're going to have the patient come up like this, make a fist for me. Okay. and you're just going to direct the patient, hold, don't let me move you, hold, don't let me move you, pushing pressure through the top of the hand. Good.
Pectoralis minor. The origin is the 3rd, 4th, and 5th rib. The insertion is the medial surface of the coracoid process at the scapula. The action is it depresses the scapula, abducts the scapula, and downwardly rotates the scapula.
Okay, so for pectoralis minor, we're going to direct the patient to bring their shoulders in a little bit of protraction. So roll your shoulders forward, if you would, for me. You're going to place pressure right here on the acromion process, pushing downward. Direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.
Pectoralis major. The origin is the medial half of clavicle, sternum, and cartilage of 1st through 6th ribs. The insertion is the crest of the greater tubercle of the humerus, and the action is it adducts the shoulder and medially rotates the shoulder.
Okay, so for pec major, we're going to bring the arm up this way. Go ahead and close your hand for me. Just support the arm right here. The pressure is going to come from the medial portion of the elbow here. You're going to direct the patient, hold, don't let me move you, hold, don't let me move you. Good job.